Hello everyone, Dr. Sharon here from Artistic Dental Studio, and I'm here with another episode of Dental Tips of the Week, and the topic today is root canal treatment. Always people ask me, well, how painful root canal treatment could be. First of all, I need to address two questions. What causes a tooth to be a candidate for root canal treatment? And the second thing, what the root canal treatment itself? Then I can answer your question. So, let's begin with the first question. Whatever causes infection in a tooth, it could be either, if we just consider this picture here, this is the normal tooth, and as you can see, it is covered with a hard enamel shell, and underneath is the softer material, which is the dentin, and then the nerve inside the tooth. Whatever causes bacteria to enter this space, it could come from the gum around, or something like a dental decay, would affect the nerve inside. And when the nerve inside is affected, or I'd better say get inflamed or infected, then we need to remove the nerve from within the tooth in order to save the tooth. And this procedure is called root canal treatment. Now let's begin with the causes. First, the most important and the most popular one is the dental decay. What is a dental decay? If you just have a look at this picture, you can easily see there are some tiny spots of dental decay on the enamel. Dental decay is dissolution of the tooth by acid produced by bacteria. The interaction between the bacteria and the carbohydrates patient normally consumes. Alright? These two, when combined, produce some acid. So bacteria get the carbohydrates, produce some acid, and the acid begins to just dissolve the tooth. This causes these very tiny areas of decalcification or decay on the tooth surface. After a while, it goes a little bit deeper and reaches the lower layer, which is called dentin. And finally, it reaches the nerve inside. As the decay reaches the nerve, because it contains bacteria, the nerve begins to get inflamed and infected, and after a while, it will die. So basically, what we need to do is to remove this nerve from within the tooth, because we cannot control infection with antibiotics only, or whatever you may think of. We need to do dental treatment. Alright? So, root canal treatment basically deals with such a thing. You just have a look at this. This is a normal tooth with the nerve and blood vessels inside the tooth. After a while, if it gets decay, then the decay goes inside the roots and causes the nerve to die and causes some infection on the tip of the roots, around the tip of the roots, and inside the jawbone. So basically what we need to do is to make sure we can eradicate this infected material, the nerve, the bacteria, everything, by insertion of some tiny needles into the tooth to clean the tooth up, and after a while fill inside the root with some kind of plastic material so we can make sure the infection will not get back. This is the root canal treatment. Now, the main question, How painful could it be? Let me put it this way. Individuals are very, very different in terms of pain threshold. There are some people that the tooth actually gets infected. They don't feel even a tiny sensitivity, let alone the pain. And then they come back to us and they say, well, I feel there's a large hole in my mouth. There's no pain. What shall I do about it? I say, okay, this nerve is gone. There is no nerve inside the tooth. It's completely infected, and you need to choose between extraction or doing the root canal treatment. But on the other side of the spectrum are some people with tiny chipping on the tooth, coming to us with excruciating pain and sensitivity. So individuals could be quite different in terms of pain. Now, there's a rule of thumb here. The more inflamed the tooth, normally the more the pain. And the more the inflammation and infection, the harder it is for us to control the pain, because we normally administer some kind of anesthetic before the procedure. If the tooth is quite infected, that anesthetic material around the tooth will get neutralized easily by the infected products. So that's very important, just to make sure if anything is happening, we can take action as quickly as possible before the tooth gets severely inflamed or even infected. Because if such a thing happens, then the chances we can control the pain will diminish drastically. And the final point that's really important for you, to have your 6 monthly dental checkup and cleans, just to make sure this thing doesn't happen to you, so you don't have to bear with pain before, during the procedure, or even after the procedure. Thank you very much for watching this video. Please leave your comments down below and share this video, give us a thumbs up, and stick with us. We're gonna have another exciting video for next week. Thank you very much and enjoy the rest of your day.